2, and we are back with, I'm hoping to have our Mountain Red Velvet people from New Zealand.
Hi, Dr. Bill. Karen here from Mountain Red.
I think I could hear some music in the background. Is that you're in? Oh, it might be from the studio. You might be playing that. So, what's the latest from New Zealand in terms of what's going on with Mountain Red Velvet? I know you guys are, we had some new certification last year in Australia, which is probably, other than Canada, one of the most difficult countries to get certification. It's used more and more. And tell us about the process, because it also, I think you guys are working on trying to do DR2 caps, which will mean it gets down to the terminal small bowel and gets converted to a micelle, which will mean the undamaged molecules will get even further into your tissues. But this is a premier, if you want slow aging and reverse organ deterioration, and you're not taking Mountain Red Velvet, I call it a nutraceutical violation. A violation. Your body, if your body could give you a ticket to say, I'm going to write this ticket up because you are not managing the body properly by taking your Mountain Red Velvet, but I'm going to expect you with a citation to correct this within 30 days, or you're going to be heavily fined. If your body could write a ticket. And it's true. I started taking Mountain Red Velvet, and old aches and pains and creaks that I had for years, the body says, I can do this. There should be a little tagline at the bottom. I can do this. The body starts to heal itself. And old aches and pains and joints and this and that, the body says, I can heal that. I don't care if it's 30 years old, 30 smears old, doesn't matter. It's 30 days old, I'll start to heal it. And you'll hear the stories about people with arthritis and deformed joints and creaky backs and scrapey kneecaps because they've got bad tracking, and their doctor's saying, I think you're going to need to have a knee replacement. And the body says, heck no, I'm taking Mountain Red Velvet. We'll see you in 6 months, Doc, and I'll be back on the golf course.
Exactly. And that's the stories that we do hear from people is, gee, I've had this niggling injury for years, and I can now get back out on the tennis court or back out playing golf, or I've got so much energy with the grandchildren, and they're the stories that we hear all the time, because this is a building block. You need this to heal.
Well, I learned a lesson a long time ago, and this is a hard lesson. And it was told to me by my professor of biology and bacteriology when I was doing my marine bacteriology PhD research back in '73. It was under Dr. Robert Brown and Dr. McBride. And it was really funny. He said, now, you finish your project in 5 months by sleeping on a lab floor, Deagle. You just have to prepare your thesis, and you'd have your PhD before you're 22. But now you're going to go into medicine to find the cause of diabetes. You're going to be dealing with a lot of knuckleheads, that's his words, and a lot of people who really don't know how to do science. And they're going to be boggled by you, and they're not going to want you to ask tough questions because they just don't want to answer it. And I have an answer to tell people out there, and this is similar when I had a dialogue the other day with Dr. Ron Klatz. Dr. Klatz sponsored me to get on doing blogging for the environmental section of the American Academy of Anti-Aging Medicine. And now I blog weekly. I'm preparing a series of articles to 26,500 doctors and 850,000 health professionals worldwide. But the public also can log on and can see these articles and so on, which I'll also be posting here on the NutriMedical Report and also on Genesis on their blogs through Deanna Marks and through Charles over there in Genesis. And I'll also be sending them over to Jeff Rent so he can post them up on his page. What people need to realize is the current models of disease and aging are wrong-headed. And they're so wrong-headed it's obscene. People don't understand. You don't go and say, well, the joint's deteriorating. I remember seeing a comic strip in my rheumatology research lab that I did back in the 70s with Dr. John Woodbury. And I was working on the synovial analysis lab when I was in medical school, and actually analyzed and did a database analysis of 26,500 cases through nonlinear statistical analysis of their data and lab work, as well as their histories and so on, the Mr. Fit study. And what we discovered is that on the comic strip it said, hey doc, I know you're saying I need to have an injection in this joint, but my other knee is just as old and it's perfectly fine. But when you start taking Mountain Red Velvet, your whole body wakes up and says, hallelujah. And they're not counting how old you are. They're not counting I got an old injury, I'm ruined because I used to be an athlete, but in high school I got a torn this and that, or in college, or in their pro sports and they get ruined. The body, if it was repairing micro injuries, it wouldn't get a macro injury. They did a study a few years ago and they found out that professional athletes in the top athletic areas of basketball, football, soccer, that 78% of people in basketball and football had a rotator cuff tear. So just looking at the shoulder joint alone is a good kind of a sentinel joint. 78% had such significant tears in the joint by an MR arthrogram, which I know how to read, by the way, that they would have, by surgical criteria, they should have surgical repair of those tears. So that what they do is they keep playing injured until they rupture. And when they rupture, then usually something really horrible happens, like with Gronkowski the year before they won the Super Bowl, where he goes and pops his ACL because he's got these monster huge muscles, but the tensile strength of his ligaments is not there. Okay, or you get somebody that gets older and they're wearing down their joint, and the joint has no hydroviscous layer, which is a fluid layer, because cartilage isn't supposed to touch cartilage. When it does, it fibrillates. You get fragments, and eventually they calcify, and then they act like little micro razor blades tearing the joint apart. Okay, so we know this biological science. I mean, I had orthopedic surgery buddies that would be sending me their photographs of the arthroscopic surgery, and I said, hey, start giving things like glucosamine chondroitin sulfate. This is 35 years ago when I worked taking care of a number of the Olympic athletes in Canada, and I also took care of Olympic athletes in Colorado Springs. And I can tell you, once you start saying, hey, take these things, after you clean up the joint, and needed a surgical cleanup to get all the garbage out of there. Micro razor blades is like putting, the little stone thing where you throw in your thing you want to polish up, and you throw it into this little tumbler, it'll tumble it until it polishes it up. Well, it doesn't polish it. It tears the heck out of your joint. And if you get the junk out of there and you start taking Mountain Red Velvet, after your body says, hey, your joint had a lube job. You've got a hydroviscous layer. You've got a meniscus that's tacking itself down. It's not flying across and getting caught in the condyles anymore. You've got a kneecap that actually has a hydroviscous layer behind the patella. Gee, I can't believe it. The tensile strength of the connective tissue is increasing in your carpal tunnel and your interosseous ligament in your lower ankle, which you tore previously doing something stupid by walking in a golfer hole on the golf course. And now your leg's not hurting, your calf is not swollen up like a baseball bat, and you wonder why you can actually walk through all 18 holes without going, and not making a face to your colleagues because they don't want to see you making faces when you're talking about business. So what people can understand is you start taking Mountain Red Velvet and the body says, I don't care how old you are, we're going to make a better you. And, to me, it's almost radical. The big question I just thought about it this morning, which is, my mind works in strange circles, is how come they haven't called out a hit contract on you guys for destroying the market for the big drug companies? I don't understand why you haven't been called late at night. We're going to take you out. You're ruining our business. This is...
They may still come.
I know, I hope not. But anyway, if they catch on that you actually are ruining their business of joint replacement and non-steroidal anti-inflammatory drugs and all the other nasties that the profession of undertakers, otherwise known as pre-embalmers or magnificent deities, otherwise known as Mordo doctors. And welcome back to the NutriMedical Report. Just talking to Karen on the break, and Karen, of course, you're holding over the next segment where we're trying to get Tom. By the way, everyone out there, you have to understand, we're upgrading NutriMedical with lots more PowerPoints and conferences and other things. We're reactivating Clay and Iron, my other website, clayandiron.com, which has the above government technology, the spiritual issues, and the geopolitical analysis, and a much broader range of news articles we're going to archive there. We're also going to cross-index the audio files to be able to find shows that you're interested in different topics. And all of them have what we call a searchable database. I designed these years ago in Java and Java Beans because I have a background and know how to do a computerized, we call website design, but this is not just HTML. These are database websites. And I had them program it for my requirements, which were quite expensive over a period of years and a lot of evolution to advance them, including password protection. So, Karen, I'm talking to Karen about the idea of where I see things going. Just like I'm going to start posting up on on my website, Wellness Conditions, not just wellness conditions, I'm going to post up ideas and idea pages, and not just for wellness conditions, but for other issues. For example, Mountain Red Velvet, because I like the Disneyland, or especially the adult side of Disneyland, where I brought my daughter on Wednesday, 22 years of age. She's been on nutritional support since before birth. And because she's been on all these different supplements, she has no health problems. She's on any cardiac drugs. She's had 2 heart surgeries. She can outwalk almost anybody. And she's happy, smart, never has any health problems whatsoever. Now, when we look at Mountain Red Velvet, what I would say is, and there was a question brought up in the first hour, because people are watching the news items about using extracellular matrix from pig bladder. Now, pig bladder, when they strip the pig bladder, or they do research at the University of Minnesota and also at the University of Wisconsin, where they're doing work on ECM, extracellular matrix, where they've done some work also with the military. They take pig bladder and they actually make it into sheets or powder and put it directly in surgical sites. And the number of biomolecules present in pig bladder is very deficient by comparison to Mountain Red Velvet, and I'll tell you a couple of reasons why. The first thing is pig bladder does have ECM, some ECM, but it doesn't contain all the cryptochromes, the laminins and matrix metalloproteinases present in fetal tissue. Why is that important? Well, Dr. Deagle likes to ask the questions. There's 3 classes of molecules that are present in Mountain Red Velvet. The first class is structural subunits to build up tissue and cellular structure and tissue. The second is what's called scalar transducers. These are molecules that attach to cell membranes and cell membrane complexes to actually transduce scalar infrared light signals into the cell to tell the cell what to do. In other words, to turn on and off genes and to activate the active pinocytosis that actually pulls in biomolecules or large complexes. And the third class deals with, if you want to call it we call organ structure and function. In other words, the switching on and off genes to regulate the level of biological conversion of different biomolecules or metabolites, and the actual structure of a tissue is a scalar signal. So this goes beyond just the cell-to-cell contact. If you don't have all these different molecules, like they are present in a fetus, you can't rebuild the tissue completely. So you get partial rebuilding. For example, their work on they call ghost heart. Have you ever heard of the ghost heart studies at the University of Wisconsin? They actually take out a heart of a lamb, and they'll infuse it, say, with human mesenchymal stem cells and see if they can rebuild a heart muscle, because they think that the collagen and the connective tissues of the ghost heart will talk to the stem cells and make them differentiate into heart pulsatile cardiac muscle cells. And they only got a 2% regeneration, but you can actually see under the visual, low power microscope, you can actually see pulsatile activity where, there is some activation of genes to turn them into pulsatile cardiomyocytes. So they will start partially transforming, but they don't completely. The work on extracellular matrix from pig bladder has shown, if you put it in the quadricep muscle of a vet that's had part of their leg blown off with an IED, or if you get it in a joint, you can actually pack the end of the tissue and it'll even grow a new joint and right down to the fingertip. So that's pretty good, but it's still not complete. What you're doing is you're activating a process that doesn't just make tissue grow like to close off a wound. It actually recalls the structure and the function, so you're actually growing a whole brand new joint and new bone tissue and new ligaments, which are complex structures because of the way they're attached to the terminal interphalangeal joint, etc., and the attachments to the side of the joint, etc., the nail bed. So you're not just talking about regrowing something so you got a little stump that looks long like a finger. You actually regrow a finger. You regrow quadricep muscle, but it's not as complete as with Mountain Red Velvet. What I mentioned to Karen is I think that we should move forward with a project to make surgical grade sheets and powder of Mountain Red Velvet and impregnate it with Nutridyne, which will kill off the pathogens, activate the mitochondria, and we could add some other components too, like myco D2, which is ergothioneine. Ergothioneine is the primary activator of the genes to actually turn on tissues for regeneration. So Mountain Red Velvet is far superior in terms of actually what's in it before you digest it, which is why we want to have DR caps. But you can make a surgical form. We could have it in a sense a surgical band-aid to put on a scrape or a burn or a wound. And surgeons, let's say orthopedic surgeons, instead of laying down and saying we're going to do a joint replacement, they could go in and infuse in the joint, say, mountain red velvet directly as microbeads in a liposomal form in the joint space after they've cleaned out the garbage, and burr down the joint with their little microburr devices to smooth out the joint surface. And they can go back and re-arthroscope in 3 or 6 months, and they'd see the joint regenerated. So, that's Imagineering. Now, as I tell people, as I said this on the show the other day, you can present me with a problem in any area of science, medicine, geopolitics, or anything on the planet, and I will come up with a framework, if not the answer, a framework of how to find the answer instantly. And I challenge anybody to ask me a question on any area on the planet, whether it's geopolitics, medicine, science, or nuclear science, or anything at all, and I will give you an answer. People say, how can you do that? 2 reasons. Number one, I asked a zillion questions, and I'm 63, but I've asked enough questions, most people would be 1,000 if they did as many as I have. Number 2, I pray, and I receive answers from the Most High God when I'm completely lost, which is most of the time. And because I have a God on speed dial, I get answers. And people say, that's not possible. I say, well, sorry to burst your bubble. I'm smart, but God's a heck of a lot smarter. And so when people say, how do you come up with a solution to many of your problems when you get a real complex case? I said, I study, and then I go and pray, believe it or not. And I get answers that way. Sometimes immediately, sometimes in dreams and visions. Sometimes God will direct me how to search and find it on the search engines, like, the National Library of Medicine, or Remed Info, or some other place, or just key in such and such, and boom, it just shows up. You need to realize it's possible. So if you're not doing Mountain Red Velvet daily, and you say you want to be healthy, you're missing the boat. You're missing the boat. You get on the Mountain Red Velvet. Now, by the way, we're going to restructure the website so you can find it easier on page 2. It'll have its own little separate banner on page 2 for Mountain Red Velvet. Back in a minute. Stay right there. And welcome back to the NutriMedical Report. We are back with open lines in any wellness issue or any issue you want to bring up at all. And we're making things much better. You'll see if you go and look at the NutriMedical, you'll see at the top on our NutriMedical Associates, we have NutriMedical membership. Important that if you're a regular customer in the last few months, since January 1, you will have already been given your membership passwords to the wellness conditions and to the live stream. And we'll change that once a year. The membership fee will allow you to have access to have full consults, but if you have an email or if you have an email and request information, even if you're not a customer, I'll give you a quick and dirty 1, 2, 3. This is what you start with. If you want more advanced consultations, you have to have a membership to get either a phone or email full consultation. We also strongly recommend that if you're going to be doing a real full wellness program, you get a QRMA machine. We also have the 8D LRIS, which is amazing. It'll even do diagnostics. In fact, one of our customers just spoke to me this morning. They got an 8D LRIS, and it showed 2 different pathogens which identified on our QRMA that were present, but it actually gives you the pathogen name. He had a Giardia lamblia intestinalis and another pathogen present in his gut, which the ATLRS will tell you. So in other words, it does a seek and find the actual pathology, whether it's an adenocarcinoma of the lung, leading tight, which bronchi it's in, or a blocked artery. And then you can actually do a frequency treatment to actually change the epigenetics, but you have to have the nutraceuticals present and the right biomolecules. I use this along with what I call my intuitive medical gifts that God's given me are amplified by this, and so it allows me to get additional information well beyond the QRMA or the ADLRIS. So when I do a consultation, I'm asking you for concrete medical information, which I will charge you a time rate because some of these can be quite time-consuming from reviewing medical records, x-rays, MRI scans, genetic testing, where you're sending me your Prometheus analysis of your 23andMe, or if you're sending me organic acid tests from Great Plains Laboratory, or functional medicine testing from, say, Doctor's Data, or Genova Metametrics Lab in Atlanta, Georgia. So I'm a master at all of these, including reading MRI scans, CT scans, X-rays, spiral CTs, quantitative electroencephalograms, etc. There basically is almost nothing that I don't do. Okay? So you know that, and I'll integrate it and tell you what specialist treatments you need, and you may redirect you to say what specialty care you need in terms of medicine, surgery, or investigations, what clinics are available around the world for your particular condition, what drugs are still safe, and there are some drugs that are safe for different conditions, but you should use minimum because most drugs are not. 90 to 95% of all drugs should not be given at all. Only 5% should be given with specific conditions and parameters, and if you do give them, they can induce deficiency states, blockades, and other problems, and you have to detoxify the drug. So if you're going to take drugs, which in some conditions is necessary, you need to know certain drugs are no-no in all cases, like HMG-CoA reductase inhibitors. And if you're going to choose between an ACE inhibitor or ACE receptor blocker, you want to go to an ARB or ACE receptor blocker. If you're going to take diuretics, you have to realize you're not just going to lose potassium, you're going to lose magnesium and trace minerals. So if you're not replacing these, you're going to get mineral deficiencies, which is not just cramps, but the risk of vascular spasm, risk of muscle spasm, the risk of seizures, and also the decreased oxidative protection, because low magnesium, your level of glutathione peroxidase is significantly impaired. So you're not just losing potassium, magnesium, you're losing selenium, copper, and other minerals, which if you have a QRMA machine, it'll tell you if you're corrected that. And that's why I tell people, if you really want to get serious, by the way, if you get a QRMA machine, you and your family, I will do QRMA tests, but if you add additional extensive medical things you want me to review, including medical records or extensive histories, which I can provide you a form, I will charge my time for actually just doing that. Now, this is not a medical consult, it's a what we call functional medicine nutraceutical consult, because I'm not going to tell you or prescribe any drugs. That's your doctor's job. Or surgery. We don't have a clinic here where you can come down. Eventually, I may, in conjunction with someone else, set up, say, help people to be able to know which clinics are appropriate, say, in Mexico or Central America or Europe or elsewhere. Maybe even start working some affiliate things where I'll train those doctors in some of the advanced techniques and technologies we're developing. I'm working right now with the people from Russia, Dr. Nemtsov and the engineers in China that are working on the latest version that advances beyond even the 8D LRIS nonlinear systems. And we're building the technology that will basically change the status of medicine, where we can actually bring down to the individual chromosome and even gene, as well as knowing the specific biomolecules. And of course, we're developing the framework for setting up what I call evidence-based quantum functional medicine, which means it'll integrate advanced medicine, so we can take blood tests, urine, stool, genetic tests, imaging studies, quantitative electroencephalograms, SPECT blood flow scans, positron emission tomography, MRI scans, etc., integrated all into one framework that's evidence-based. Rather than just being airy-fairy, take this, you're all better. No, we're not, quote, pushing a vitamin. We're giving you targeted metabolic nutraceuticals to overcome metabolic and genetic defects, to overcome pathogens, to resurrect mitochondrial function, to change the redox of tissues, to stimulate tissues to have the extracellular matrix and the signaling apparatus to regenerate tissues. This is very, very advanced, real healthcare. What we have is a substitute out there in the public where they combine what I call interventional medicine, which is good. If you got a broken bone, especially if it's sticking through, you need to see an orthopedic surgeon. If you're in the process of having a heart attack or stroke, you need a clot buster drug. But what you should have had long before is you should have been on the things like nutraceuticals to prevent the formation of the clot in the first place and reduce blood viscosity, the rheologic blood flow viscosity, and the inflammatory markers in your blood. And you should have been having functional medicine screening to know what things are present now with no symptoms whatsoever that later on are going to give you a horrible pathological outcome or a very nasty symptom. And the problem is that symptom-based medicine is not logical, and it's expensive. And you have to think when you start to nationalize healthcare, which is what basically is going on in America as you're moving from Obamacare. And by the way, neither party is going to get rid of Obamacare. They're going to try to get rid of parts of it that are noxious. What they should do, though, and this is my prescription for healthcare for America, if you talk about solutions, is you should get healthcare not because you have insurance, but because you're an American. Number two, you get rid of all state licensing boards and go to national boards that are run by doctors, health professionals only. And you should allow also training so that people can cross specialties. They can start off as a massage therapist. If they take online and actual specific centers of excellence training, they should move from massage therapist to nurse practitioner, to doctor, to neurosurgeon, to professional orthopedic surgeon, whatever, so they can move sideways through the healthcare professionals depending on their proclivity of interest, their talents, their abilities. And that way we can have people literally going straight into something like, quote, Harvard Medical School, but much of the training is going to become online. Like I will be doing more and more, setting up training areas for training health professionals, because I'm getting more and more requests from doctors around the world for consults, and then more and more people wanting to kind of learn all of Dr. Deagle's, not just the solid information, but the approach to learning new information which they need to acquire. And that's going to be replicated by thousands of doctors around the world through our different academies: the American Academy of Anti-Aging Medicine, the American College for Advancement Medicine, the American Academy of Environmental Medicine, and AAPS, the American Association of Physicians and Surgeons, that supports sovereign independent physicians. And the way it should be done is that you just simply pay the doctor an hourly wage based on the years of experience, training, and public service. If they're doing public service in the government or research, they should be paid bonuses. You can also tip your doctor just like you can tip your waiter. And doctors could, if they're really, really good, they're going to have their schedule full up pretty quickly. They should have a pyramid-type system so a doctor can see a patient for an hour if they need to, and the nurse practitioner and technicians can do the technical things, so they don't need to see 50 people a day. They might see 12 people a day, and everybody else does all the other pieces of the puzzle to release them to actually do the intellectual work of problem solving and fixing patients. And if they need to spend an hour, they can spend an hour, and it doesn't cost you another cent. That's real health care. Back in a minute. And welcome back, and we have Jim in Minnesota. And Jim, in Minnesota, we had a few moments to just talk about some of your issues. Just to summarize, Jim basically has been involved with a lot of sports, a lot of orthopedic surgery, but you have polycystic kidney disease, PKD, and you're at 20% of normal renal function on the glomerular filtration rate. If you get under 10 to 15%, you end up on dialysis or need to be put on the transplant list. Either you get hemodialysis or peritoneal dialysis. Peritoneal dialysis is you can't do it for long, and you run the risk of getting a peritoneal infection, where they use the peritoneal membrane as a dialyzing membrane rather than the external dialysis. They have home dialysis now too. What we can do is try to keep you from ever getting there. I asked a few questions, and I got the impression that your doctors really didn't explain how PKD caused kidney function to decrease. Is that right?
Yeah, that's correct. Yeah, he just basically said it takes over the kidneys.
Okay, what happens is the cystic areas start to take over and damage the glomeruli. And what are cysts? Basically, the cystic changes are due to inflammatory changes in the kidney that form cystic enlargements that damage the glomeruli, and you lose glomerular filtration. The first best marker is not just total proteinuria, but microalbumin. And microalbumin shows your kidney glomeruli. So the first and most important component to protect your kidneys is vein away, which is diosmin. It's a specific nanoparticle size enzyme that will actually restore and protect your glomeruli from further damage, either oxidative stress or anatomical stress from expanding cystic disease. Second thing you need to take is nutriodine and mitochondrial rescue, because every solid organ in your body, including your brain, your peripheral tissues, your muscles, is in the sense of mitochondriopathy. And there's specific, as the mitochondria deteriorate, the crosstalk between mitochondria and the alleles in your genes can cause degenerative changes, whether it's hepatitis causing hepatoma in the liver from chronic viral infections, or astrocyte dropout in your brain, so you start getting Alzheimer's disease, or dysmyelination in different areas of the brain, like in the tectum of the midbrain that causes Parkinson's. So the first thing you want to do is take vein away. Second is you want to have solid organ regeneration. You want to take Nutrifos, and you want to take Minerals Plus, Vitamineral Max, and copper sabacate. Copper is very important for solid organ regeneration, but you have to have you have to have some zinc as well, and not throw it too far out of balance. You also have to make sure that you prevent cross-linking of proteins, which occurs in inflammatory changes. That would be allithiamine and ultrathiamine B1 that prevents, especially if you're diabetic, if you're trying to protect kidney function. And then Mountain Red Velvet. I recommend taking a capsule under the tongue 4 times a day to regenerate, microdose, and full vitamin K2, which helps to stimulate the tissues to cause apoptosis of cells that are accumulating or damaged, ellagic acid, and malignant arrest, malignant block. And what malignant block is these are going to repair the DNA of the damaged tissues or make the cells go through apoptosis, because it's the accumulation of senescent or damaged cells that are not eliminated by the body that causes cystic changes in the kidney. And this is one of the models of the SENS model in terms of what aging is. One of the 7 points is the accumulation of senescent cells that are actually not eliminated completely by the body, and they cause disruption of organ function. So when you take full vitamin K2, along with high-dose power C, it stimulates apoptosis along with the ellagic acid and malignant block. And what those do, they're from what they do is they stimulate the DNA repair, or they commit the cells to apoptosis, and the body can eliminate them. The Nutridyne will, along with mitochondrial rescue, we use, and again, this is what I would do for yourself as Nutridyne, 5 to 10 drops 3 times a day. Mitothyroid for thyroid and adrenal support. The adrenals as well, I'll be giving you adrenal support, because when your kidneys are deteriorating, you usually have adrenal dysfunction as well, at least a capsule twice a day. And remember, you're not taking a hormone, you're taking a support for the gland, so it's not going to you're not going to get elevated levels of cortisol or Cushing syndrome or hyperthyroidism by supporting your thyroid. You want to take a form of CoQ10 ubiquinol, and you want to take a form of carnitine. We have a new vascucarnitine, which would be particularly good for you. We have the mitocarnitine, which is the propionyl L-carnitine attached to glycine, and we have a long-acting form called IBS Care that's a slow-release form for the bowel, primarily for the mitochondria and the myenteric plexus of your bowel to restore normal peristalsis. So for the kidney, in what you're having in PKD is you're getting accumulation of senescent cells that form cysts that eventually damage the glomeruli, and it's one of the models of what causes aging. And your best marker for that is a level of microalbumin, which is dropped to 0, and the non-progression on an ultrasound of your kidneys, as well as the monitoring glomerular filtration rate with a 24-hour urine and protein analysis of creatinine clearance. And you don't need to do an IVP or these other things. The ultrasound's adequate, along with these other markers, to measure your kidney function. And your kidney function should gradually increase over time. I would also be taking Mountain Red Velvet, at least a capsule into the tongue 4 times a day, along with things like Myco D2 that has ergothioneine to stimulate tissue regeneration, Microdose, and of course our other nutraceuticals. But I can flesh out the protocol a little bit more advanced. You also want to use what's called I recommend mild hyperbaric oxygen for stimulation of stem cell release. Silver 100, which is not only an antipathogenic, it's a stem cell stimulant, and the use of kidney, if you want to call it, lumen photon therapy. And we're actually working on the technology to put specific treatment frequencies in there that'll be coupled to the LRIS. So that actually during the treatment session, it'll alter the frequency spectra. Right now, you'd probably benefit from a NICO setting, putting it over your kidneys for a couple of hours twice a day. If you put the lumen photon pads, and I get the dual 264, which is 2 pads you can kind of splice together, and put it over your kidneys and your lower back, you'll notice that if you're measuring inflammatory markers like C-reactive protein or angiotensin converting enzyme markers, that it's going to restore to normal within a matter of 6 to 12 weeks using the transdermal cranial across the skin to your back, because the energy is high enough to transfer through 12 inches of muscle, bone, ligaments, and your kidneys, and it'll help stimulate the regeneration. So that combination of hyperbaric oxygen, lumen photon therapy, and we're also looking at bringing out a new version of the micropulse, it's called, developed at NASA for stimulating stem cell regeneration. But you have to get rid of the senescent cells, restore the mitochondria, support the minerals and other components to rebuild the connective tissues and the solid organs, and you got to prevent the glomerular cell dropout. And the best markers, I say, is microalbumin and creatinine clearance, and an ultrasound to make sure the cystic lesions aren't expanding. Okay,
all right. Well, I really appreciate your help. I'm I'm trying to write it down as fast as I can.
You don't have to worry about it. I got a photographic memory. If you email me, I'll just do a data dump for you.
All right. Well, thank you very much, sir.
You're surprised, aren't you?
Yeah,
I told you a little bit more than your doctors did, didn't I? And remember, I give glory to the Most High God because, you see, God's given me not only the medical talents, He's given me the ability, if I don't know something, where to go find out somebody that knows more than me, and there's lots of them that do that, doctors around the world, resources, and also just give me dreams, visions, or instantly He give me an answer as to what to do. And it comes down to integrating the best of medicine, because there are some very good things in medicine, and avoiding the worst of medicine and the best of genetics and other work. Have you had a genetic profile done to see if you have any gene snips or polymorphisms or other toxicological injury to your body that might have triggered off or accelerated the PKD? Have you ever had military exposure to, for example, to solvents, toxins, depleted uranium, or anything like that?
Well, that I don't know. I mean, back when I played pro football, they were giving us Motrin like crazy, and
Motrin's very toxic. Motrin, by the way, interferes with glycosaminoglycans, so it'll destroy your joints. But Motrin also will interfere with what we call the regenerator prostaglandins, because there's some good prostaglandins that help protect your kidneys and other organs from degenerative changes. And, for example, Motrin will interfere with the normal enzymatic pathways that get rid of senescent cells. So when you take Motrin, you not only interfere with the glycosaminoglycans, you actually interfere with what's called the progression toward apoptosis, programmed cell death, and the removal of senescent cells from your tissues and organs. Motrin's bad stuff. Nobody should take it ever, just like HMG-CoA reductase inhibitors, Zocor, Lipitor, Crestor, drugs like Xarelto and Aliquis. There's a long, what I call Dr. Bill's hit list, which if you take them, you need to get hit on the side of the head. Yeah, doctors are still doing it today. Don't worry, there's no shortage of knucklehead doctors still doing it. I call the generally pathetic, so they're still doing it.
Absolutely.
Pretty bad. Yeah, you can take these drugs now and it'll destroy your kidney function. If you're on Motrin today, say goodbye, my kidneys. It was nice knowing you.
No, I haven't taken that in 15 years.
Don't take non-steroidals. You want to say goodbye to those kidneys.
Yeah.
Okay.
All right.
Genesis is defined as an origin, creation, or the beginning. Genesis Communications Network began with the mission of providing you with a